Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. NREM versus that of the REM. So NREM versus the REM. The NREM, if you see, it is nothing but the sleep or it is a synchronized sleep. So it is a sleep or the synchronized sleep, and you have the eye movements. So how is eye movements? Eye movements is that there is no rapid eye movements. No rapid eye movements. So NREM sleep, synchronized sleep, there is no rapid eye movement. The brain activities is that it is decreased from wakefulness. So it decreases from wakefulness. So brain activity, the eye movements is no rapid eye movements. The brain activities is that it decreases from the wakefulness. Next is muscle tone. The muscle tone is, it is low. The muscle tone it becomes low. Then the body temperature, if you see, the body temperature is that it decreases. So NREM sleep, the eye movements, there is no rapid eye movement, the brain activity decreases, the muscle tone low, the body temperature decreases, the body movement will be present. So body movement, it is present. The body movement is present. Then the heart rate, if you see, heart rate and the breathing, it is again slow. Then moving on to the sleep stages. How is the sleep stages? You have the sleep 1, 2, 3 and 4. So in case of 1, it means it is light sleep. Light sleep means if you look at the EEG, it is loss of the alpha wave, and there is a predominance. There's predominance of the theta wave. So there's loss of the alpha wave, predominance of the theta wave. Then comes the stage 2. Stage 2 means the EEG, you have the sleep spindles are seen. The sleep spindles, they are seen, as well as the K complex is something which is seen. Then moving on to the stage 3. Stage 3 is where you have the deepened sleep, and here the EEG, you have the delta wave. The delta wave appearance is something which is seen. Now moving on to the stage 4. So what happens in case of stage 4? The stage 4 is where you have the presence of the deep sleep, and the EEG, it has a predominance of the delta wave. Next we move on to the REM sleep. So under REM sleep there is eye movements, rapid eye movements are seen. Then brain activities, it increases the motor and the sensory area. So motor sensory area is increased. Then looking at the muscle tone, it is relaxed. Muscle tone is relaxed and it is paralyzed. Muscle tone is relaxed and paralyzed. The body temperature in REM sleep, it increases. So body temperature in REM, it is increases. It is increased. Body temperature in REM, it is increases. Now how is the body movement? So when you look at REM sleep, it is the muscle tone is relaxed and paralyzed. The body temperature is increases, and the body movement is absent. The body movement is absent. Then looking at the heart rate and the breathing. Heart rate and the breathing, it increases, as well as it is irregular. Now how is the sleep stage in case of the REM? The sleep stages. The sleep stages is there is a paradoxical sleep, that is rapid eye movement. Then EEG, it returns to the alpha and the beta wave. So return to the alpha and the beta wave. And there is also the sawtooth appearance which is seen. Then the pontogeniculo-occipital spikes. The pontogeniculo-occipital spikes. To learn and grow daily like this, please do subscribe.